take you guys through what I've been doing to kind of manage my pregnancy acne. As you can see, I do still have a breakout on my chin, but it is much better than it was earlier this week, which I'll insert a photo or clip of here somewhere. Hey guys, and welcome back to my channel. If you're new here, my name is Sara. I have a 20-month-old son named Suleiman, and I'm expecting baby number 2 on February 2020. So I was just about to take you guys through my 23-week bump date. I'm currently 23 weeks along. I hit 23 weeks on Friday, and there's been a lot that's been going on this week. I'm going to start off by telling you guys a little bit about the baby. At 23 weeks, he's currently about 11.8 inches long, and he's about 1.3 pounds or so. He's still the size of an eggplant because between weeks 21 and 23, they're roughly that size. At this point, the baby's lungs are developing. They have this product called pulmonary surfactant. A surfactant basically sits on top of, it is like a surface active agent, and a humectant goes into. So basically, this surfactant, it sits inside the lungs as a coating, and it prevents the lungs from sticking together. The next thing that is happening this week is the baby gets startled with loud noises, and I did notice this. It's just a giant truck that was dumping a lot of loud concrete, and as it was doing that, the baby basically jolted, and I felt my uterus basically just go like The hair is currently changing colors. It should now be turning into the color that it will be when I give birth, inshallah. So Suleiman's was almost black when he was born. I'll see if I can find a picture and insert it here for you guys. Now his hair is reddish brown. So this is not the color that it's going to be forever. Their hair color can change up to age 3 and sometimes past then. They are starting to recognize voices, and I do notice this because when I'm saying something, they're kicking quite a bit, and when my husband's saying something, I feel like they're just listening. This is also around the time where others can start to feel kick. My husband has not really felt the baby kick that much because, like I said last time, I have an interior placenta, so it's really difficult for this little guy to make himself known. Let's talk about what's going on with me, mama. So I'm gonna go right into the first symptom because you can probably notice right away, I'm out of breath. I'm out of breath all the time. I feel like I'm just constantly catching my breath because I'm always out of breath. I still have sickness, HG. It usually for some people does go away around 20 weeks. Still going very strong at 23. I had this last pregnancy as well, so if you have HG, let me know in the comments. I am considering making a how to survive morning sickness or just pregnancy sickness video. If you're interested in that, let me know and I'll make it. The next symptom that I've been having is insomnia, or lack of sleep, we'll say, because insomnia is quite a big term. I have had a lot of difficulty sleeping, and I feel like I'm constantly just trying to get comfortable, and even when I am, my mind's racing. There's so much going on. I want to nest very badly, and that's just always in my head. Swollen glands in my armpits. Really weird symptom. I mentioned this to, I called up my doctor and I asked him about this. It's totally normal. You can get swollen glands, you can get swollen chest, glands in your chest as well with the milk production. This is probably related to breastfeeding, and I do feel like in this pregnancy I'm developing faster in my chest than I did with my last pregnancy. The next symptom that I wanted to talk about was spotted vision. So sometimes when I bend down or when I get up suddenly, like the whole room becomes just spotted. I see like little tiny spots. I had this a lot with my son's pregnancy, even without doing much. I was on bed rest for his pregnancy. It has me a little bit on edge because it's a really uncomfortable symptom to be going through. And I know that I'm doing a lot this pregnancy as I'm looking over after my toddler. And the next symptom I'm going to talk about, the last one, is pregnancy acne. I've been dealing with a lot of pregnancy acne. It's hormonal because most of it is on my chin. I get a little bit on like here on my cheeks, again, also hormonal. It's not a pleasant symptom. I really wish there was such thing as a pregnancy glow for me, but the only glow I have is sweatiness. So TMI, but definitely not feeling that. So I do have a kind of coping system that I'm doing right now to handle my pregnancy acne, and I'm going to take you guys through that. I'm going to take you guys through what I've been doing to kind of manage my pregnancy acne. As you can see, I do still have a breakout on my chin, but it is much better than it was earlier this week, which I'll insert a photo or clip of here somewhere. The first thing I like to do is double cleanse. So I use this one right now. I start my double cleanse like that. I put some oil in my hand and then I work it into my face. I'm going to wet this and wash this oil off my face, and that's going to help emulsify it. So I add a little bit of water and start emulsifying the product. And you can see it's starting to do its thing. Now for the second part of the double cleanse, a fresh soy face cleanser. I'm using my Clarisonic Mia. Yeah, Clarisonic Mia. And I'm just gonna get that into my face and try to clean my pores as best as I can. And I just I go upwards. Now I've washed that cleanser off my face. I'm gonna go ahead and apply a mask at this point because I don't wanna put products on and then put a mask and wash them off. I'd rather do the mask at this step. I use a clay mask. This is by Near Beauty. And as that's drying, I'm gonna just go ahead and apply these. Just leave it there. And after 15-20 minutes max, I'm going to wash this all off. So it's been about 15 minutes. Everything's almost completely dry, but I'm going to just take this off now. Little guest here, by the way. Bye. Bye. I'm just going to take these off, and then I'm going to give this a quick rinse. Now, I washed it off with lukewarm and hot water on my nose, just like slightly warm. It's not like hot, because I'm going to use a vacuum. This is a blackhead vacuum, and I'm just going to go over my nose to make sure that there's nothing in my pores. I don't do this every night. You can see that's gross. I'm going to start off with this Mario Badescu spray. And I like it because it has aloe, so aloe is soothing. My essence, I've shown this before. I'm going to go ahead and put that on. And back of my hands, and I usually do my neck as well. I'm almost done with this product, which is the La Roche-Posay. It's like for face and eyes. And then hyaluronic, just boost. And I'm going to put that all over, especially on my nose, which is red, my chin, cheeks. So what I'm going to do now is I'm going to use this little wand, and I'm going to do a bit of lymphatic massage. So I turn it on, it's ionic, and I'm going upwards like this. Oh, that feels so nice. So it's at this point that I'm going to be using this, which is a beauty oil. They use them as a carrier oil. I have a little bit of tea tree. This is going to be for some acne treatment. I'm just going to put one drop. And then I'm going to just put it as a spot treatment onto my spots that are active, the active breakouts. What I'm going to do is my moisturizer. Always moisturize. Dab, dab, dab. Upwards, always. Lip balm. Always put on lip balm. If you can see, it's mostly gone down a lot, the redness already, and the acne is not as bad as it was earlier this week. I will show you maybe in my next update how that's looking, but this is how I manage the pregnancy acne so far. And with that, I think I'm going to show you guys my bump. This again, I love the look of having a little bow over the bump. I think it makes it look cute. And then this is it from the side. You can see it's really big. I feel like it's huge. But I feel him right there currently, which is where he loves to rest. He likes to rest right in the center, and then he kicks me either here or here, depending on which way he's facing. That's my 23-week bump, baby. There you go. So with that, I'm going to call it a video. If you guys like these types of videos, please be sure that you hit up that like button. I'm going to be continuing to do bump dates every Tuesday, so make sure you have your notification bell turned on and that you're subscribed so you can follow along with my pregnancy journey. Let me know how your journeys are going if you are also pregnant, and let me know if you learned anything from this video, or if you'd like to learn anything or hear me talk about anything specific down in the comments below so we can chat. Until then, I'll see you guys next time. Bye-bye.